Good afternoon, everyone. My name is Michael Vouffo. Today I'll be speaking about my Thomas F. Freeman Honors Senior Thesis about the major impact of artificial intelligence on AI, specifically the promise it can bring for a good hope for the future, the risk that comes with using new technologies, and what role this is going to play in terms of not only implementing it, but seeing how it can impact the world. So, first off, looking at the concept of AI itself, people tend to think of it as a fully autonomous robot or something that just does the work for you. When in reality, AI is really just a tool that's capable of autonomizing a lot of different roles we do, whether it be simple things like using maps or having dictation done for us, or even just a lot of handheld or busy work tasks, people might call it. It's meant to be able to simplify these things and not only just have a person who just reduce the time it takes to do it, but just make it one less burden for the day itself. And especially whenever looking at how AI can be applied to medicine itself, people have to remember the value that it brings. It has real value when it's used as a support tool that can obviously supports the people that train years and years to not only specialize in different roles in medicine itself, but also try to take down a lot of the basic work, because as we're seeing in this day and age, medicine is not only the world of taking care of people, it's also a business as well that comes with a lot of extra work that comes to it. Documentation, insurance companies, all these different factors that have to play into roles of how a clinician can not only take care of a patient, but on a case-to-case basis. So this thesis should be able to argue and support the fact that as a clinician should be able to responsibly integrate it, it can be helpful towards their path in using it. So with this study itself, I did a structured literature review to not only, just because with medicine itself, it has a lot of different aspects that plays a role, policy, health education, clinicians, or even just future outcomes that can come with it. So doing the structured literature review, I did a combination of different types of papers, whether it be peer-reviewed studies, local governance, or even evidence-based studies as well that different researchers are seeing in terms of the role. And I also focused my work on three main questions essentially. The first question being, how does AI improve health outcomes and efficiency when properly applied? Secondly, what ethical risk comes with using AI? And thirdly, how can AI be integrated responsibly? So, obviously, like I mentioned before, AI isn't just a single piece itself. It has the different layers that help to build up what it is essentially, especially the main three pieces being machine learning, deep learning, and CA, also known as computer-aided diagnosis. Just being the fact that whenever you think about, let's say, whenever you think about using something as simple as Siri, Siri is literally just a tool that takes publicly available knowledge and just applies it to what specifically you want. It's given the task and it's given a solution based upon the task given. It can be the same way in medicine itself. So AI as a tool also has existed for numerous years as well. It's only now that publicly people are seeing AI. For example, with Claude, Gemini, ChatGPT, these public tools are really the reason why the public is so, oh my goodness, it's so new, it's so interesting. It's just because people are using it publicly now. Even more so, if you look at this timeline as well, AI as a concept has been proposed all the way since the 1950s. Even more interestingly enough, has been invested in medicine since 1975 with the National Institute of Health doing its first major sponsorship towards research work. Now, obviously, between that whole time period, we never really seen AI was used that big as a medium just because technology itself wasn't able to keep up with it. It was hard to scale and it was very expensive. For context, for example, a lot of big effect we're seeing in terms of how AI is being done now is because of technology chips, or like, let's say, hard drives, RAM chips, things like that. At that point in time, around the 80s and 70s, a powerful computer could be considered maybe 500 megabytes of RAM. An average MacBook, which is what most college students use, have about 8 gigabytes of RAM just casually now. So not only is the technology available able to scale and speed up way faster than it was in the past, it's just a lot more easier and feasible and cost-effective to do it now. That's why we're seeing, for example, right around the year 2000 as well, whenever deep learning was established for the public as well, all these major different companies was having AI brought to us closer. 2011, Siri was brought to the iPhone, which made it publicly available for them to tap on their phone. Farmabout was used. Alexa, the Amazon assistant. Everyone has, a lot of people have their phone now. But it wasn't until it was not only affordable, but viable for companies to have it publicly brought out, that's when it became a concept to not only everyone, but just comfortable with everyone itself. So, specifically, how is AI being used in the medical field itself? There are three main avenues that a lot of medical companies are using it, especially within the medical center itself. They're developing a tool. Those being diagnostic imaging, predictive analysis, and administrative workflows. So let's start off with diagnostic imaging, just because that's the one that most patients will like have an impact of being seen used, especially. So diagnostic imaging, anytime you go to the hospital, there's the general types of images. So there are also listed right here. Your X-ray, your CT scans, ultrasound, and MRI are the four most common types you might see used with patients. When it comes to diagnostic imaging, the way that it's being used with AI is they're able to have models be able to detect and read these type of images and be able to interpret what a healthy body scan would be compared to small, minute abnormalities. So, for example, let's say, especially with CT scan, because I myself have actually assisted with MD Anderson developing a AI tool to help assist in diagnostic imaging. And specifically with the tool itself, what it did was it took a CT scan and looked at a patient who's going through radiation therapy treatment or who believes they have radiation therapy for head and neck region itself. It will look for certain sites that will obviously have like unclear readings, like with a CT scan, it will detect how much density is through the area itself. If it has abnormal certain areas of readings, that will be a sign that, hey, something's wrong, let's have a clinician come and look at it. This is a second set of eyes, just because if you have a clinician, especially people within the field of radiology and pathology, looking at hundreds upon hundreds of CT scans in a day, it can be mind-numbing to miss the minor details. Having AI as a second reader or a second set of eyes to look at what you could miss is a way to help you out. And secondly, predictive analytics. So being that patients tend to have electronic health records based upon the different type of medical systems they're at, they'll have upon hundreds of medical documents, whether it be labs, vital signs, past imaging done, past diagnoses they have. Being able to go through all those various documents for a single clinician can be time consuming, especially on a patient-to-patient case. Especially if you, even worse, if you're a specialized individual. Like let's say, for example, an oncologist. If you're an oncologist trying to figure out, okay, patients is starting to develop a tumor in this site. What various things could have caused, what could have led up to this, and what I need to keep an eye on, I want to start radiation therapy treatment with them. So, being able that you can give the system the whole electronic health record, it can be able to sift through those different records to see what risk stratification it's having and have early detection for any special type of symptoms or health conditions that could be developing essentially. And thirdly, administrative workflow. So, like I mentioned before, medicine is also becoming as big as a business as well. With the business, there's a very common terminology that's used by many business workers, CYA, cover your behind. Just because documentation is going to be most important when it comes to the clinician doing his work. If you're doing something for the patient and it isn't documented why you're doing it, the next question that takes on the patient is going to be, why did you do this? How did you lead to this? Why did you make these decisions? Everything. So whatever it be, something like taking notes, be able to taking notes of patient visits, dictations, or even just chart summarization, it definitely cuts down the workflow on those clinicians, just because the time it could take to read an entire patient chart when they come in for an oddly random condition can be definitely cut down by time if you just have somebody to be able to sift through a lot of the reading for you. So the ethical issues with the AI itself. So with a technology system looking through electronic health records, obviously the public has big concerns when it comes to not only the privacy of your data being used by a system itself, but also the consent in terms of like, is it okay for systems to be able to use this? Mm-hmm. That's why you're seeing a lot of new governance in terms of like, hey, data privacy, who has access to this data? Who is able to open this stuff up? Who is it being shared with if I ever had to get external services with my lab records? That's why we're seeing not only within the government itself, but also within the different hospital systems, they're coming up with new policies and new laws when it comes to who is able to safely access these things. Just because something people tend to forget is that medical systems also have very strong IT departments, because you never know who can try to break in and try to steal medical data. It's one of the most valuable things in the world. So, bias and inequities. So, artificial intelligence can be viewed as the same way a person has nature versus nurture. There's what it's designed to do and there's what it can be taught to do. Artificial intelligence is taught to do many of its tasks. Anything it does is based upon historical relevance to what it's seen in the past before. So if you teach, for example, if you teach a model to treat certain patients certain ways, it will begin to pick up upon those habits you do, and it will be able to apply it whenever it starts to give future diagnosis in the future. So, being that can be both a great thing and a horrible thing, because if you see an overall positive the model, it might be good, but you can see an overall positive for most patients on average, but then you can see for certain population groups, it will be ineffective for. That really isn't that useful if you're having certain groups be left out when the job is to be able to help every single patient in the first place. And thirdly, transparency and accountability. Most AI models, especially generative AI like ChatGPT, Gemini, Claude, and all of them, tend to be input a CT scan for a chest. Output will say patient has likely has pneumonia. And whenever it comes time to ask, the system really isn't that good at explaining why it said that. It will just use what is done in the past to be able to detect and see this is what I believe it is. Whenever compared to a clinician having to do his job, he'll be able to determine, okay, this is what I'm seeing on your CT scan, these are your symptoms as well, this is the history you're having, and this is the situation that could have caused this. They have to be able to look step by step to explain the whole situation, because obviously you can't just come into the patient and say, I'll put it through our AI system and it looks like I got pneumonia, so I'll just give you some antibiotics, it'll be fine. Sadly, that's not how medicine works. It's important to remember itself as we try to scale the different things that we want AI to do. Efficiency is a great thing, but efficiency cannot be used to efficiency cannot be used to neglect the sake of quick patient turnover rates. Because if all we're looking at is the numbers of how quickly we can get patients in and out, we're not taking care of the public correctly. So, the big old question, will AI ever replace doctors? No. AIs will never replace doctors. Just because of the fact that medicine is way more than just being able to diagnose patients and keep it pushing. Like obviously in certain medias, for example, Grey's Anatomy, The Pits, or even Chicago MD, these type of media that present medicine in a certain way often cuts out a lot of the in-between work for what it takes to take care of a patient. Not to mention the fact that 100 upon 100 of different services that a hospital has to be able to do to properly care for its patients. You need to not only be able to make judgment calls, you need to have empathy, you need to have quick decision making, you need to have trust in yourself and the patient between you and them. There's a lot more different pieces that a piece of technology couldn't be able to, although it can do its best to mimic, it will never be able to truly do itself. So obviously, AI can be good for when it comes to things like automating tasks, is taking away a lot of the repetitive things that makes treatment slow or get response time slow, can make it not only give you more face-to-face time with your patient, but also ensure that, hey, we're taking care of a lot of the heavy loads so that you can just literally sit here and we'll do what we can to take care of you. Now, obviously, whenever it comes to clinicians themselves using these AI tools, they need to be sure that they're correctly supervising how the tool is being used, and they still need to translate, hey, this is what we're doing for your treatment, and this is what these are steps we're taking, just because it's never a good sign to ever just do treatments, sort of patients find and leave. Like, you didn't tell them what they went through, and even worse, the patient is educated, be able to tell the next clinician should they have a working situation based off of what happened in the past. So it's always important to be able to take it from a patient-to-patient basis, and just being ethical with it in the first place. Also, something that people always love to use when it comes to determining what is work is precedence. A big example of how technology made a big influence upon an industry itself is the internet itself. If you look at medicine before the internet was introduced, be able to look up a patient's record was pulling through a gigantic filing cabinet of this entire patient's history, from a child to adulthood to elderly age, and every major surgery they could have had. To take that and be able to put it on an electronic health record and search up within seconds, not only streamlined a lot of the busy work it took to be able to figure out what past history the patient had, but also made it a lot easier to do a lot more interdepartmental tasks, whether it be sending orders for prescriptions or just contacting a different specialist to come and evaluate a patient or see if they need to be brought in for further care. Simple things like this not only save a lot of time on the clinician side, but also save the patient a lot of time, because now instead of being able to have to spend the entire day at the hospital, you can probably spend one visit for 30 to 45 minutes, have any variety of lab tests done, have any imaging done, or speak with any specialist you need to speak with, and be on your way and have communication set at a later time. Now, as amazing as this was as an innovation for medicine, this was also a very big unintended pressure that wasn't seen by a lot of people at first. So being that they could be able to take in more patients at a quicker rate, there was a new expectation of, okay, now that we can have a quicker rate of patients we're taking in, we should be able to bring them out just as quickly. Now people start looking at hospitals like, okay, I expecting with this many clinicians and these type of skill sets should be able to bring in and bring out this many patients efficiently. Now you've gone from the model of taking care of people or the model of keeping people pushing through, a throughput model instead. Now, if you take that same mindset as a double-edged sword and look at it with AI, technically it can be beneficial, like I mentioned before, but we're obviously expecting the same thing. There's no way you can't just introduce a piece of technology meant to not only streamline and take away the busy work and not have new expectations put upon that. So as much efficiency as you're gaining with this, you also gotta understand as well, the choice that comes with the policy is gonna be coming further. Like mentioned before, there's policy being made upon how AI is being responsibly used with this. What could that be? Could that be whether, oh, if you're not going to be a medical doctor, you have to follow these regulations with AI. If you're not a medical doctor, we expect you to be this quick working in our system. So that's both the positive and negative that comes with trying to define. Is it successful? Is it hurting the clinician's workflow? Is it the gray area between trying to determine, is this what's best for the future? Now, responsible integration. Right there to the left is a model that's being used by a couple hospital systems now when it comes to deciding how to have new AI models implemented. So, design and develop, evaluate, validate, diffuse and scale, monitor and maintain. This is meant to be as a centralized form of, if we want to add in these new models, let's add them in following this like a scientific method of sorts for AI models to be implemented in essentially. And some different recommendations I have in terms of systems, not only like keeping AI models regulated, but just keeping them in check as well, just because if we're looking at the internet, for example, to this day, the government is still trying to catch up on regulating the internet on various things it can do, whether it be having consumers' data, just being able to advertise certain things to certain ways to the public. All these different regulations are taking so long. On the AI side, it's just starting now. So imagine how long it would take for fair and equitable regulation to be in place to ensure there can be no misuse of this type of stuff. So first off, risk tier standards of evaluation. If you're using AI for a high-level task, make sure you scrutinize the AI highly and make sure you double-check the work you're being used for. Even if it's for the same task. For example, let's say I'm doing an administrative task. Let's say I'm going to be reviewing a patient's chart and I'm going to be doing documentations. Technically, that's the same administrative workflow task you do on the same device. But one of them needs to be critically looked at because although you can have your patient chart summarized with AI, generative AI is very good at messing up even simple details. And if you read one thing wrong, it could be horrible. For example, let's say the patient BP gets put in a single digit wrong. That could be the difference between hypertension and hypertension and hypotension. So it's important to look at some things like that. And even then, equity-focused reporting and subgroup monitoring. Like I mentioned before with bias. Bias is learned. It is never given to someone. So let's say, for example, if we're having great results within older white male patients, and we're having great results across most white male patients, it's a good thing. But if you start looking at your total health, at your total population data, you're seeing that these particular group, for example, indigenous women, you're seeing very low health outcomes when using AI tools. Are we really doing good using the tool then if we're having a specific group specifically not have good results? So you have to be sure to monitor how it's being used and make sure it's being used equitably across everyone. Additionally, strong privacy and consent protections. If patients are going to have, obviously if patients have medical records, they have a fair expectation that their medical records are protected and reasonably used, not obviously being shared with different untrusted individuals across outside sources if used for malicious things, especially being that AI systems, as great as they are, they also do come with, they also can have a lot of excess information put out by accidents that can be dangerous if not properly monitored. So it's important to ensure that if clinicians are going to use them, make sure you're monitoring where you use the systems and where you leave it at as well, just to make sure there's no risk of leaks and no harming patient data as well. Clear accountability across clinicians, institutions, and vendors. It's pretty common to see the word sue get spoken in a hospital or any medical environment, but when it comes time to sue someone, the question is who's going to be held liable? Is it going to be the clinician that used the AI tool? Is it going to be the institution that forced the clinician to use the AI tool? Is it going to be the vendor that has a contract with the institution to make physicians use the AI tool? The question is who will specifically be responsible if something bad was to happen? Now, mind you, all three of them will try to claim, oh, it's the algorithm. That isn't how suing someone works. You gotta have a person to serve the papers with. So obviously, if you're gonna have a major tool used in your system and it causes a bad situation, you need to clearly say who will be at fault for this situation and determine would the person be willing to still use it if they're gonna be at fault. Next, ongoing monitoring for model drifts. So a very clear example of this will be, let's say, Ben Taub's, for example. Ben Taub's Hospital is one of the major trauma hospitals within the Texas Medical Center. Is currently seeing an expansion within a little bit of Herman Park itself. With that expansion, they said that they might be possibly looking into creating new departments at their with their trauma hospital systems. With those new departments, they could want to maybe implement or create new AI models or take existing AI models and apply to their type of work. If they're going to use it, they need to ensure that they properly transition it to whatever their specific needs are. Just because you can take most general models, whether it be a diagnostic imaging model, for example. Most departments do use some sort of diagnostic imaging before performing whatever procedure they need to, but at the same time, you need to ensure that it's specifically what you need it for. It needs to be updated, it needs to be redone, it needs to be tweaked. Change it accordingly. Don't just try to make a one size fit all, because most garages will always have a different size tool for different types of screws. And last but not least, do not turn efficiency into unrealistic patient volume. Just because you have a tool that can shorten the work for you doesn't mean it has to be done any faster or incorrectly. It's always important to make the effort and take the extra step for being responsible, especially with our adoption still being very new to many industries. Let's make sure we do it safely and with the tool clearly. So the biggest takeaways from exploring this new field of this new aspect to medicine itself is definitely AI is capable of being a very real opportunity if it is done correctly and if it is done responsibly. As beautiful and as shiny of a golden egg as it is still an egg that can be easily cracked. You need to make sure you nurture it, you need to make sure you take care of it, and you need to be willing to say, no, it's not working, yes, it is working. Because if you're not willing to critique it, then what's the point of having it in the first place? The benefits are very strong for clinicians whenever they make sure they remain essential to it and they use it correctly. If a clinician sees that it has purpose for them, good. If they see it doesn't have purpose for them, nothing wrong with not using it. Do what you did before. If what you're doing is working, then it works. And thirdly, augmentation does not mean replacement. Take what you're already doing and evolve it. Do not try to just replace what you're already doing, because there's a reason why clinicians were doing it in the past. Don't just throw away the old models for the sake of doing something completely new that might not work until proven. So the future of hospitals will not be full of robots. It will just have new algorithms and new ways to assist in the work that they do for the future. So expansion will still have human care and will not be replaced, thankfully. And these are the various references I use with the World Health Organization, various research laboratories, as well as some local governments in terms of medical imaging as well. Thank you.